Namaste everyone. Let me ask you a simple question. Did you sleep well last night? If yes, congratulations. If not, you're not alone. In today's fast-paced world, sleep often takes a backseat to work, social media scrolling, or binge watching that one more episode. But what if I told you that the quality of your sleep directly impacts your heart health? Surprising, isn't it? Sleep isn't just a luxury, it's a necessity, especially for your cardiovascular system. Welcome back to Cardiowise, and today we are diving into the fascinating connection between sleep and heart health and uncovering why sleep is a non-negotiable part of your heart health. So grab a pillow, or maybe just don't, because I don't want you to fall asleep just yet. Trust me, by the end of this video, you will never take your 8 hours for granted again. To begin with, let's dive into the fascinating science of what happens to your heart while you sleep. So think of sleep as your body's maintenance crew, coming in every night to clean up, repair and restore balance. These restorative processes are crucial for a healthy heart. So sleep includes two parts: the restorative NREM, or the non-rapid eye movement sleep, which progresses from a light to deep one, and the REM sleep, where dreaming occurs, that is, the brain is active but the body is relaxed. So during the non-REM sleep, your heart rate slows down, your blood pressure takes a healthy dip, and this is what we call as the nocturnal dipping. It's like your heart taking a mini vacation. This reduces the strain on your heart and the blood vessels and gives them time to recover. So sleep isn't just about resting your body, it's also a powerful hormone regulator. During sleep, your body keeps cortisol, the stress hormone, in check. Also, your autonomic nervous system, the body's autopilot, is deeply influenced by sleep. It's like two siblings: the sympathetic system, which amps up your heart rate, and the parasympathetic system, which calms things down. So sleep ensures that both of these stay balanced. This nightly repair process is essential for maintaining your heart's strength and longevity. Without it, your heart remains in an overdrive mode, increasing the risk of high blood pressure, irregular heart rhythms, and long-term damage. Now think of this like your car engine. So if you keep it running non-stop without letting it cool down, it's bound to overheat and break down. Sleep is your heart's downtime. It's how it cools down, repairs, and recharges. So what happens when you don't sleep well? We all know what it feels like to have a bad night's sleep. Grogginess, irritability, and an extra large cup of coffee to get through the day. But what you might not realize is the profound effect that poor sleep has on your heart. Now let me explain. Even after just one night of poor sleep, your body releases higher levels of stress hormones like cortisol and adrenaline. These hormones will cause your heart to beat faster and your blood vessels to constrict or narrow, thereby increasing your blood pressure. Imagine your heart is running a marathon while you are sitting still. An occasional night out might still not be of much long-term consequence, but chronic sleep deprivation can lead to a domino effect. Since the nocturnal dip doesn't happen, a condition called a non-dipping pattern, you are at a higher risk of hypertension. There can be thickening of the heart muscles, which we call as left ventricular hypertrophy, and other cardiovascular complications. Elevated blood pressure puts constant stress on your heart and arteries. Also, poor sleep promotes inflammation, which accelerates the buildup of plaques in your arteries, which is what we call as atherosclerosis, and increases your risk of heart attacks. Arrhythmias or abnormal heart rhythms can also occur. Disrupted sleep can actually upset your heart's electrical system, increasing the risk of irregular heartbeats. Poor sleep also disrupts the insulin sensitivity, paving the way for diabetes, another major cardiovascular risk factor. Over time, this strain can lead to major heart events like heart attacks, strokes, and even heart failure. Our lifestyle often leads to late nights, be it studying, socializing, or even watching the long cricket matches. Long work hours and deadlines leave us little room for quality sleep. Unfortunately, this habit of compromising sleep is silently harming our hearts. Now that we have talked about why sleep matters for your heart, let's back it up with some hard facts. Numbers tell a story, and in the case of sleep and heart health, they paint a clear picture. Poor sleep is a major risk factor for cardiovascular disease. Let's start with some important and staggering statistics. People who sleep less than 6 hours a night have a 20% higher risk of myocardial infarction, which we commonly call as a heart attack. So this was confirmed in a 2019 study which was published in the Journal of American College of Cardiology. Secondly, for individuals with sleep apnea, the risk of developing atrial fibrillation, a serious heart rhythm problem, is nearly 3 times higher. There's another remarkable finding. Improving sleep habits when combined with lifestyle changes can lower high blood pressure by 20 to 30%. So that's comparable to the effects of some medications, but without the side effects. So these numbers aren't just statistics, they represent real lives saved by prioritizing better sleep. That's the way I look at it. For someone with borderline hypertension, adopting a consistent sleep schedule could mean avoiding years of medication or a life-threatening cardiac event. Have you heard about the sleep villains? Disorders that sneak into your nights and wreak havoc on your heart. These aren't just about bad dreams or the occasional sleepless night. They are serious conditions that can have long-term consequences for your cardiovascular health. So let's understand them. First up, obstructive sleep apnea or OSA. This condition causes repeated interruptions in breathing due to airway collapse, leading to hypoxia or low oxygen levels. And this can cause surges in your blood pressure. So you may snore heavily or feel fatigued or sleepy in the day. Although you may not experience these interruptions in breathing as awakenings at a conscious level, your brain does. So think of it as your body going through small fights every night, leaving your heart exhausted. OSA is no joke. It significantly raises the risk of hypertension, atrial fibrillation, coronary artery disease, and even heart failure. Imagine your heart being pushed into an overdrive every night, and that's the toll OSA takes. Snoring might get a nudge from your partner, but if it's loud enough to wake the neighbors, it's time to get it checked out. It's not just annoying, it could be deadly. Next comes insomnia, chronic sleeplessness. So it isn't just frustrating, it also keeps your body in a state of constant alert. The sympathetic nervous system, the one responsible for the fight or flight, works overtime, raising blood pressure and increasing the risk of arrhythmias. Over time, insomnia can lead to metabolic syndrome. So that's a cluster of risk factors for heart disease. So think of it as body's way of saying enough is enough. And finally, there's restless leg syndrome. So this is a sneaky condition that causes involuntary movements during sleep, disturbing your rest and affecting the autonomic nervous system. That's your body's internal balance keeper. Studies have shown that restless leg syndrome is linked to higher cardiovascular mortality due to chronic autonomic dysfunction. So simply put, your heart isn't just getting the peace it needs to recover. Let me tell you, these disorders aren't just annoying quirks, they are major players in heart disease. If you or your loved ones struggle with snoring, sleeplessness, or twitchy legs, consult a doctor or a sleep specialist. Early diagnosis can save your heart a lot of trouble. So by now, we know that sleep is essential for your heart, but the million-dollar question, how much sleep does your heart actually need to stay healthy? Okay, so let's break it down. The golden rule is 7 to 9 hours of sleep for adults. So if you're sleeping less than 6 hours, it's too less. And if you're sleeping more than 9 hours, that's too much. But always remember, quality matters just as much as quantity. Interrupted or shallow sleep won't give your heart the same benefits as deep restorative sleep. Think of it like recharging your phone. If you unplug it every few minutes, it won't fully charge, right? Your heart works the same way. It needs uninterrupted sleep to recharge. So how do you know if you're sleeping well? Ask yourself, first, are you sleeping 7 to 9 hours consistently? Second, do you wake up feeling refreshed? And third, are you snoring or gasping for air at night? If you're unsure, consider using sleep tracking apps or wearables to monitor your patterns. But remember, these are just tools, not replacements for professional advice. So the message is very clear. Your heart thrives on balance. 7 to 9 hours of quality sleep is your heart's happy place. Stick to it and you are giving your heart the care it truly deserves. So ready to snooze your way to a healthier heart? Here are some science-backed strategies that will help you make most of your Z's without the drama. First up, the power of a routine. Going to bed and waking up at the same time every day, even on weekends, helps your body's internal clock stay on track. Next, set the stage for sleep. A cool, dark and quiet room is your best bet. You can invest in blackout curtains or even earplugs to keep disturbances out. Avoid scrolling through your phone in bed. Your bedroom should feel like a sleep sanctuary, not a carnival. Caffeine might be your best friend in the morning, but it's your worst enemy at night. No smoking and heavy meals at least 4 to 6 hours before bedtime. Ideally, no smoking ever. And while alcohol might seem like a shortcut to dreamland, it's a trap. It messes with your REM sleep. So if you need a snack before bed, choose sleep-friendly options like a warm milk or a handful of nuts. They contain natural melatonin and magnesium. Stressed out? Your heart knows it. Combat stress with relaxation techniques like mindfulness, meditation, or even simple deep breathing exercises. Think of these as your bedtime lullaby for your mind. Simple habits like a warm bath before bed can also be very calming. Believe me, these simple changes can make a world of difference. Remember, your bedroom is for sleep, not for Netflix marathons or late night Zoom calls. Well, sometimes no matter how many tips you try, getting good sleep feels impossible. It's important to know when poor sleep isn't just a passing phase but a sign of something deeper. So let's talk about the red flags that mean it's time to seek medical help. So firstly, loud snoring. A person snoring loudly with their partner unable to sleep is a red flag. Second, pauses in breathing. As I mentioned before, you may not be able to identify that yourself, but your partner could. Thirdly, extreme daytime fatigue. So you may feel groggy through the day and maybe doze off without intent at times. Fourthly, difficulty falling or staying asleep despite having followed all the hygiene measures that we have described. Fifth, unexplained mood changes. Are you feeling irritable or anxious with sleepless nights, waking up too many times in the night to visit the washroom? In that case, you could need help. So while these symptoms might seem small, they can indicate serious underlying medical conditions. Left untreated, these conditions can significantly increase your risk of heart disease, high blood pressure, and other health complications. Today, we have excellent diagnostic tools like polysomnography or even at-home sleep studies to pinpoint sleep disorders. These tests can measure your oxygen levels, heart rates, or even how many times you have stopped breathing in the night. The good news is that these disorders are treatable. So whether it's using a CPAP machine for sleep apnea, therapy for insomnia, or some medications for restless leg syndrome, there's help available to get your sleep and heart health back on track. In India, many people dismiss sleep problems as minor inconveniences, but ignoring these signs can lead to long-term damage to your heart and overall health. Remember, poor sleep is not something to just live with. So, good sleep isn't just about feeling refreshed, it's a pillar of heart health. By prioritizing your sleep, you're not just recharging your body, you're giving your heart the care it deserves. To wrap up, prioritize sleep like you would prioritize your diet or exercise. A well-rested heart is a happy heart, and a happy heart is the foundation of a long, healthy life. So if you found this video helpful, hit the like button, share it with someone who could use a good night's sleep, and don't forget to subscribe to Cardiowise for more science-backed tips on keeping your heart healthy. Sweet dreams, and I'll see you in the next video.